knowledge begins with senses, proceeds then to understanding, and with reason. There is nothing higher than reason. And so, to quench our thirst for this reasoning, we shall proceed with the next session. For our next session, we have our guest speaker, Dr. Sheila Kumar Gujari ma'am, who will speak on periodontal management of oral diabetics, which will be chaired by Dr. Deepika PC ma'am and Dr. Vijay Desai sir. I request Anita ma'am to introduce Dr. Vijay Desai sir and Dr. Deepika ma'am. Over to you, ma'am.
Good morning, everybody. It's a pleasure to introduce our HOD, Dr. Deepika PC. Ma'am has completed her BDS from GDC Bangalore and MDS from Bapuji Dental College, Davangere. She's worked as a professor from 2012 till date at JSSDC&H. And currently, she is professor and HOD of the Department of Periodontology in JSSDC&H. She has many national and international publications to her credit, and her area of interest in periodontal regeneration. Is periodontal regeneration. She's put in a lot of national and international publications and research work too. Can I have the next slide, please? I welcome you, ma'am. Dr. Vijay Desai sir has completed his BDS from Bombay University in 1987 and MDS in periodontology from Harvard University 1994. He's currently working as an assistant professor with more than 30 years of teaching experience. He is the reviewer for JIS. Sir has been associated with Royal Australian College of Dental Surgeons, IDA, ISP, and Emirates Dental Society. Contributed as a speaker in more than 25 conferences. Sir has attended more than 30 international conferences. It's a pleasure to have you on this forum, sir. I welcome you, sir. Over to you.
I request Dr. Vijay Desai sir to introduce Dr. Sheila Kumar Gujari ma'am.
Good morning. I'm Dr. Vijay. I hope you can hear me. I'm in Goa now. Currently, I'm on a vacation, annual vacation. So it's a pleasure to introduce Dr. Sheila Kumar Gujari. In fact, I know her from the Dharwad days. She was my colleague in Dharwad when I was doing my post-graduation. She was a very loving and lovely lady that time. And since then, I have not met her or not come in contact, but it's my pleasure to introduce Dr. Sheila. And happy that she has done her master's in Perio, and she's my colleague now. She has done a BDS from KMC Mangalore and then did a MDS from JSS Dental College. She has been HOD for more than 10 years, and she has published several articles in national internet journals, and she's published more than 75 articles, and I'm happy about that. And at the same time, she's also a very good researcher, and her main research interests are in periodontal medicine and as well as periodontal regeneration. So, Dr. Sheila, I'd like to hear from you now, and I'll hand it over to you and go ahead. And thank you very much for the organizing committee for organizing such a lovely, important topic. Thank you, Dr. Sheila. And the mic is over to you.
Yeah, I'm very happy to see you after so long, Vijay.
Yeah.
And I was there as a lecturer when you were doing your PG. And after that, I came to know about you from others, but I was never in contact with you. So now I'm so much happy after so many years. At least Anita has done this job of getting us together. So I should say my special thanks to Anita for giving me this opportunity to meet you again. Thank you, and I hope we'll meet in person.
Yeah, sure. Let's hope.
Even I convey my greetings from Manil.
Yeah, sure, yeah.
Okay, yeah. So
let's wait for the pandemic to go down, subside a bit, when we could meet in person, which is more interactive as compared to webinar, but still nothing better than at least having a one-to-one talk. So all the best, and hope to see you soon. All the best. Okay, go ahead. Thank you.
Yeah, today my topic is periodontal management of diabetes. And I think most of this, you have already got the background of diabetes and the immunological aspect. And all the speakers have been speaking and giving you all the necessary information. So finally, I am left with the management part. So as has been told that in diabetics, it is more, the periodontitis is more in diabetics compared to the normal. They are at more risk, and depending on the glycemic level, the risk is more. Also, the exact mechanism, even though it is still being researched, it is being told that it is mainly due to the immune functioning and neutrophil activity and cytokine biology. So the main inflammation is the main thing that connects diabetes and periodontitis. So, as you already have been having enough lectures about the two-way relationship, but still, I'll just go ahead with the flow chart here. You can see in diabetes, there's hyperglycemia, which leads to the defective polymorphonuclear function and the vascular disturbances, basement membrane thickness, and AG is found, which causes a defective collagen synthesis and also affects the PMN and macrophages by getting attached to the receptor RAGE, and also it results in a defective host response and resulting in increased infection susceptibility. So at the same time, periodontal disease, there are bacteria which release the endotoxins, and both in both the situations, in both diabetes and periodontal disease, this results in an increase in the pro-inflammatory mediators, an increase in interleukin-1 beta, TNF alpha, and a decrease in the growth factors, which can result in an insulin resistance. So this is a vicious cycle that is uh, going on. So if you control diabetes, even periodontitis can, periodontal diseases, if the severity will be reduced, and periodontal disease also can have, if the disease is controlled, is treated, then you can have to a certain extent a decrease in the glycemic control.
Periodontitis is inflammation of the gums and supporting structures of the teeth. If untreated, it causes tooth loss. Did you know that periodontitis and diabetes are closely linked? People with periodontitis are more likely to develop diabetes, and vice versa. Diabetes increases the prevalence, progression, and severity of periodontitis, and periodontitis influences blood sugar control in diabetes. The good news is that periodontitis is easy to diagnose and control. Keep the following tips in mind. To prevent gum disease, seek advice from your dental care professional twice a year. Early treatment of periodontitis may reduce the risk of prediabetes. If you suffer from diabetes, share your diabetes medical history with your dentist. Watch your weight, eat healthily, and don't smoke. Control your diabetes. Reduce stress and practice physical activity. Brush your teeth twice a day. Clean in between the teeth every day. Use interdental brushes or floss. Remember, periodontal therapy is safe and effective. Take care of your gums. Control diabetes.
So coming to a patient, when a patient enters your clinic, what do we normally do? We will go in for an examination of the oral cavity, and most of the time, some of the patients do not know they are diabetic. And we have had a very extensive presentation by Dr. Amrita about the oral changes that can take place in the oral cavity. So we should be very observant and be able to see these changes. And sometimes The patient might also come saying that the patient has noticed that there's mobile teeth and bleeding from gums and things like that. So then we need to check the oral cavity properly, and if there are things, there is a oral picture which makes you more suspicious, especially if the patient is also of an older age group, then it is always good to keep in mind to do the routine blood investigations. So you have to send them for the routine blood investigations, and sometimes by these routine blood investigations, we sometimes come to know that the patient is diabetic. So already the values of what are the blood tests that are done, like your fasting blood sugar, the glucose tolerance test, hemoglobin, HbA1c test, all these are tests that help in diagnosing diabetes. And this has been also very well uh, explained by Dr. Prasanna. So I will just go ahead. So these are some of the common periodontal manifestations. The most common that you can come across is your multiple periodontal abscess, and the severe destruction that you can see, as well as sometimes xerostomia and these other pictures like candidiasis, geographic turn. These are the things that can make you a little suspicious uh, of diabetes, especially this dryness and sometimes xerostomia. There is salivary gland dysfunction, and that could be due to the effect of the glucose levels seen in the peptic glands and the bacterial growth, which leads to all these infections. So the periodontal disease, the signs and symptoms, as we all know, there can be more of redness, inflammation, and loose teeth, and migration of teeth, receding gums, and halitosis, hypersensory. All these are part of the signs that can be seen in a diabetic, as it is more exaggerated in a diabetic compared to the normal individuals. So this is a patient who had come and was unaware that the patient was diabetic. There were some gingival abscess and enlargement, and so these are some of the things that, as I told you, you have to check for gingivitis, periodontitis, multiple abscess, xerostomia, candidiasis, ulcerations. So all these will give you a picture. In addition, once you come to know that from the blood investigations that the patient might be a diabetic according to the reports. But the reports should be repeated. It's not that with one reading you should go by it that the patient is a diabetic. So and once the patient is detected, then we do need to send to the physician. And if the patient is a diabetic, then what the dentist should ask is, you should know the duration and type of diabetes, the medications that are prescribed, whether any recent changes in medication was there. So that gives you an idea of whether the patient is under control. And also recent blood investigation, most recent HbA1c, have they had any attacks of hypoglycemia, hyperglycemia, history of any disorientation, any ulcers in the mouth, do you feel dryness in the mouth, and any other medical history like hypertension, history of stroke or kidney problems. So all these things should be taken into consideration the moment you know the patient is a diabetic. So only if the diabetes is under control, then you can proceed with your treatment. So patient is uncontrolled, the patient needs to be referred to a physician for the control of the diabetes. So these are the various medications that some of the patients who are not able to maintain the sugar levels by diet alone will have to be given medications. And these medications, some of them you have to be careful because they have more chances of the patient going into hypoglycemia. So you have this oral medications and the insulin preparations. So you should know what type of medication they are on, so that if you're planning any surgery or any treatment, you should be careful that you do it at such a time that um, it is the effectiveness of the uh, medication is there, or you can end up in other complications like hypoglycemia. So the main management of diabetes actually lies in the patient. First, the patient should be able to change the lifestyle, be have good compliance with the medication, and the patient should be educated. We have to do our part of informing the patient the complications of the diabetes and its implications in the oral cavity. So it is our duty also to educate them and make sure that they know the importance of controlling the blood sugar levels. Only then we can go ahead with our treatment. So also we should be able to know how compliant the patient is, how the patient is going to maintain the oral health, and also about physical exercise, how that will reduce the insulin resistance and increase the glucose uptake. So the treatment options, what we have to do, as I said, before starting any periodontal treatment, what we need to keep in mind is first consult with the patient's physician to assess the diabetes control. Next, you should update the medical history and medications and review it at each appointment. Confirm that patient has eaten and taken medications before initiating treatment. Anticipate and be prepared to manage hypoglycemia. Prevent, treat, and eliminate infections promptly. Ensure excellent oral hygiene and provide profound preventive care. Reinforce regular diet, medication regimen, and also make sure you have a glucometer so that at any point you can monitor the insulin levels, or I'm sorry, the blood sugar levels. Now, the most common thing that we come across is the periodontal abscess. So sometimes this patient's present with the periodontal abscess and we don't even know that the patient is diabetic. This has happened to me also because in my family, my mother-in-law was accidentally diagnosed. She had a periodontal abscess. No, she had come just for a regular scaling. And after the scaling, she developed an abscess, and later on, it ended up in cellulitis. So we didn't know that she was a diabetic, neither did she know. But after we got the blood test done and things like that, that's how we came to know she is a diabetic. So this is how accidental findings will be there. And sometimes, like I told you, she ended up with cellulitis just by just going for a scaling. So this is why we should be aware when nowadays, especially because the incidence of diabetes or the prevalence of diabetes is very high. So first, this periodontal abscess should be treated if it is the tooth is not going to be of giving a good prognosis. Then it's always better to get it extracted. And if it can be maintained, then the drainage should be done and the appropriate antibiotics should be prescribed. And it has been seen that fasting blood sugar of 180 mg per deciliter is a cutout point for any selective dental extraction. Yeah, whether to put the patient on antibiotic, not to put the patient on antibiotic. Many people ask whether this prophylactic treatment of antibiotics, if it's required. But actually, there's no proper study which confirmed that antibiotics should be given prior to treating the diabetics. Maybe in conditions like abscess, drainage and all, we do need to give them antibiotics, and the combination antibiotic is found to be the best when you're doing also, if you are going to give it as an adjunct to scaling. Amoxicillin with metronidazole has been found to have a good effect. Apart from that, you have you have azithromycin. You can give it to people who are allergic to beta-lactam drugs, and clindamycin, and also yes, doxycycline also is being given. Um, and in this emergency extractions, as I told you, um, you have to be very careful if the patient is not controlled diabetic. Um, it can doing extractions in uncontrolled diabetes can lead to osteonecrosis, can go to cause dry socket and other problems. So the cutoff range is 234. If supposing you need to go for a emergency tooth extraction, then the postprandial of a value of 234 is the cutoff point for emergency tooth extraction. Yes, once the patient is under control, then the mechanical therapy, non-surgical therapy, scaling, root planing um, can be done, and this will reduce the inflammation and the concentration of the circulating cytokines, which can help in improving the metabolic control of the diabetes. Even local drug delivery of doxycycline, mainly its horse modulatory effect, has been found to have an effect on the CAL and probing depth. And even though there are very few studies on it, they have found that this also is quite effective. Yeah, this is, I should say thanks to my postgraduate student, Dr. Saro, who has done a dissertation under the guidance of Dr. Pratibha. They've used laser in a diabetic patient, and good results were obtained. Even photodynamic therapy, but in this photodynamic therapy, not much effect has been seen so far. Still studies are going on, but this is also being tried out in diabetics. And concerning root canal therapy, yes, most of the infection, most of the tooth loss has been attributed to extractions are attributed to teeth that have been treated by root canal, and also in diabetic patients. And that's what most of the teeth have been because of the rise in blood glucose. So the mechanisms by which they say that there is more, that the prognosis is not that good in periapical infections. So that has been attributed to the chronic inflammatory conditions predisposed by diabetes, reduced tissue repair capacity due to the diabetes, and it also affects the immune response, making them more susceptible for the infections. So alteration in the mechanisms of bone turnover and apical repair can cause, it's not that favorable. So in diabetics, unless it is under control, it's better not to venture for the root canal procedures. Same thing goes in for the surgical procedures. Surgical procedures also, it has found that there is improvement, but the patient should be under control. And if you're thinking of any regenerative procedures, then you definitely need to follow up the patient and see that the diabetes is under control and the patient is motivated enough to make sure that he is going to maintain the sugar levels in control. And yeah, because it affects the regenerative capacity. And even though, like, even bone grafts, there's not sufficient evidence to say that you can't use bone grafts in diabetics, but there are cases where when bone grafts were placed in diabetics, we have found them to have infection. It got rejected in some of our patients. So and there's not uh, enough evidence to tell about the regenerative property of the bone grafts, even though recent studies of Emdogain have shown that the follow-up of 3 years, they found a regenerative capacity in patients with type 2. But again, the patient diabetes level was under control. So even though it's followed up for 2 years, that uh, the patient was compliant. Platelet concentrates also have been used, and it is a rich source of the growth factors. So it has helped, and it's anyway, it is the patient's own, it doesn't cause any other reactions. So platelet concentrates can be used without any fear in diabetic patients. Yes, bone loss is, diabetic patients are more prone for bone loss, and the actual mechanism of the bone loss was explained by Dr. Anirudh. So we know that diabetic patients are more prone for this. That is because there is an imbalance between the osteo um, blast or the uh, bond forming and the resorptive because of the imbalance in this. So diabetes affects the osteoclast and osteoblasts. It increases the expression of the inflammatory mediators and rankle osteoprotein ratios, and enhances the levels of AGEs and reactive oxygen species. The elevated levels of AGEs are found in the periodontal of diabetics and results in an increase in the pro-inflammatory cytokine expression and induces osteoblast apoptosis. So this is regarding the bone loss pattern in diabetics. So this why uh, why this is stressed is in case you are planning of doing any implants in a diabetic patient. So you have to keep in mind that there is progressive loss of bone in diabetic patients, and unless they're really under control, it's better not to go for an implant. But there, at the same time, it has been seen in certain studies that the patient is just like a healthy person once the blood sugar level is under control. So we could go ahead with the implant. Maybe the survival rates have been found to be less. So this is again a flow chart explaining the alveolar bone loss. That is, in diabetes, there's increased rankle OPT, increase in the AGE, increase in the ROS, and the increase in the inflammatory mediators, which result in enhanced periodontal ligament and osteoblast apoptosis, reduced bone formation, and enhances the osteoclastogenesis, which is responsible for the alveolar bone loss. At the same time, the periodontal disease causes the presence of the bacterial products, which cause the change in the host response, and again aggravation of the pro-inflammatory cytokines. So that's, as I told you, dental implants are safe and predictable for dental rehabilitation in diabetics who are under control. And also they found that the survival rate of implants in diabetics does not differ from the survival rate in healthy patient within the first 6 years. But at the same time, there is peri-implant inflammation is increased in diabetic patients. So coming to the complications that you commonly face in the clinic, you can come across hypoglycemia or hyperglycemia. So how do you recognize this signs? Um, the symptoms are shakiness, anxiety, increased sweating, hunger, and and how do you treat this? This is, you can administer 15 milligrams of simple carbohydrates. If you have a glucometer, check again. And if the blood glucose level is still more than 60, then patient should be asked to eat or drink sugar sweetened beverage. But if it is less, then repeat again with 15 grams of simple carbohydrates. Check the blood sugar in 15 minutes and continue till you achieve a level that is above 60 milligrams per deciliter. So at the same time, you can even go in for hyperglycemia. And this is more seen in uncontrolled diabetes, and it's due to the ketoacidosis. So it occurs after a prolonged elevation of blood glucose. Ketoacids causes metabolic acidosis, which may lead to coma if left untreated. The symptoms of hyperglycemia include shortness of breath, breath that smells fruity, nausea and vomiting, very dry mouth. So this is a more dangerous situation where the patient can go into coma. The doctor should be aware of the duration of the action of the oral hypoglycemic drugs and insulin regimen taken. So these are the things that you need to keep in mind when diabetic comes to the. So other things that, as you know, there is delay in wound healing, and why this delay in wound healing could be due to the defect in the platelets, neutrophils, macrophages. There's limited vasodilatation, poor leukocyte infiltration, cell basement membrane thickening, glycosylation aggregation of blood cells, leading to increase in viscosity of the blood. So another thing is there is immune where the chemotaxis is affected, the phagocytis is affected of the neutrophils and monocytes. There's poor tissue oxygenation and increased risk of infections. At the same time, the fibroblasts, also the proliferation rates are decreased. There's decreased growth factor, low collagen content in the granulation tissue, absence of cross-linking in the collagen fibers, which could be responsible for the delay wound healing. Also the myofibroblasts and epithelial cells, there's reduced contraction and prolonged granulation. So this is a flowchart which is depicting the normal wound healing and poor wound healing. So as you can see, it is mainly triggered by the macrophage activation leading to pro-inflammatory cytokine, which can trigger the MMP levels, which causes a more matrix degradation, which can lead to poor wound healing. And at the same time, there is neutrophils releasing the reactive oxygen species, which is also responsible for the destruction scene. So again, one more flow chart here, also the hypoxia that leads to reactive oxygen species and the AGEs, and also hyperglycemia, which will also trigger the reactive oxygen species and the glycated end products, as well as the keratinocyte dysfunction, fibroblast dysfunction, higher MMPs, impaired angiogenesis, impaired neovascularization, decreased host immunity, and neuropathy. These are the things that can lead to impaired wound healing. COVID and diabetes, this has already been covered up by many of the speakers. So we all know how prone diabetics are to corona and how severe the cases are in a diabetic patient. So, and the what we have seen is about the various fungal infections that have been spoken about in detail. So we find even in the oral cavity, you can find abscess and uh, related destruction of the alveolar bone leading to maxillectomy. So this is how severe it is because, and these are the various articles that you can go through. So coming to mucormycosis, this is a picture showing that in a diabetic patient. And this is all triggered due to the use of steroids. So to conclude, diabetes is a major risk factor for periodontitis, and the risk of periodontitis is increased approximately threefold in diabetic individuals compared with non-diabetics. Management of diabetic patients require constant communication between the dentist and physician. Patients should be aware of the link between oral and systemic health. They should be educated about the importance of maintaining blood glucose levels and the risk posed by the uncontrolled diabetes. And now in COVID times, glucose control is difficult, and diabetic individuals have low immunity, which make them more susceptible to the post-COVID complications. And many times, as Dr. Prasanna had told, that getting the glucose level under control after post-COVID is a very difficult task. So it is very important that the physicians refer the patients to the dentist. At the same time, the dentist also should have a constant consultation with the physician regarding the patient's status. And also you should be aware of the complications that the patient, diabetic patient could have and might not have known about it. So it's our duty um, to educate them. And sometimes patients have hypertension, and they might even have cardiovascular problems. So they may be on blood thinners or anticoagulants. So you should keep that in mind when treating such patients. So always keep an idea of what are the medications the patients are on, so that you can consult with the physician and see the right, so you can do what is right for your patient. Yeah, and yes, we have been having a diabetic care clinic in our department for past 5 years. So this was our aim in trying to monitor the patients who are coming, educating them. We have conducted many educative camps and also conducted programs where yoga, the effect of yoga on blood sugar levels, all those things, diet, everything was explained to diabetic patients. So it is our, we are very much interested in following up such cases and seeing that we break down uh, this nuisance diabetes. And yes, Anita has also come up with an app which will help us to track the patients and keep in touch with them and help to educate. And let us hope that we will uh, end up in trying to help the diabetic patients in future. So I come to the end of my presentation. I would
Thank you, ma'am. You widened our perspective regarding the topic, and I'm sure everyone here is delighted by your speech. I would like to request our panelists to present their views on the topic.
Hello, Sheila. Very good presentation. I know this diabetic and oral care is very dear to us, and we've been having this clinic in our department for some time. Without much ado, I think I will start the questions. There are quite a few in the box. I'll just come to this. Dr. Selvakumar Jayaraman asks, what is the cutoff value of blood sugar level for laser therapy?
Cutoff of 7 glycated hemoglobin is the ideal for any of the periodontal treatment.
Okay.
So it should be 7 or less than 7.
Okay, thank you. That is for any surgical therapy. And then one more question. Does blood sugar cutoff value change with surgical and non-surgical therapy? I think you sort of answered it. Does blood sugar cutoff value change with surgical and non-surgical therapy?
I think what you are trying to ask is about glycemic control.
Yes.
Actually, there are many studies which say that it improves. It's a controversial thing. So there are many studies which support it and many doesn't support it. That is because of the difference in the conduct of the studies and the subjects taken in and all that. So basically, in a glycated hemoglobin level of 9 and above, they have found the glycemic level to come down to around 0.5, 0.4 to 0.5. So there is a minimal decrease, but that is only appreciated in glycated hemoglobin levels of 9 and above.
Okay, thank you. One more question. Does the treatment of periodontal disease vary in COVID patient with diabetes? When is the right time to do it?
Yeah, the right time is, I would suggest at least 4 weeks after the RT-PCR test, or once you're confirmed that you're not a diabetic, not a COVID patient. So we wait for at least 4 weeks and wait for the reports to come before
starting periodontal treatment.
Yes.
Okay, thank you. One last question. Oh, not many more are there. This is similar. When is the right time to treat diabetic patient? It is at peak insulin level. What? I don't know. It's not type 12. What is the right time to treat diabetic patient? It is at peak insulin level. Will that cause hypoglycemia? Not very sure of this question. Probably he's asking about hypoglycemia, I think. Okay, we'll skip this. Then we'll go to the next one. How effective is host modulating agents in diabetic patients?
That also is very controversial. There are many host modulatory, like statins also have been used. So it is very controversial. There's no conclusive evidence till now. But doxycycline has been found to be best compared to others.
Okay. Thank you very much. I think we've answered all questions, and I'll look at the chat box now, and some people are appreciating your presentation. Dr. Tejavati Nagraj says, good presentation. Thank you. Good initiative. Well done, organizing committee. Saurav is here, whose case we displayed. Very nice presentation, Sheila ma'am. 3 days program was very informative. Then Dr. Vandana also appreciates your videos and clinical pictures. So I think overall it was a very successful presentation, Sheila. Very simply stated, very simply presented in a very simple manner, which is most important. We don't understand complicated things, as we all know. And now I think back to Sumuk, if we can play that nice video.
Yes, ma'am. I'll play the video now.
Yeah, thank you, please.
Thank you so much.
And before that, 1 minute, I think I've excluded my co-panelist, Dr. Vijay Desai, if you have to add anything to this.
No, thank you, madam. I think Dr. Sheila has covered everything, and we have been listening for the last 3 days about the starting from the pathogenesis to the treatment part, the last part of it. I'm working in UAE, so from my experience, I feel that as Dr. Sheila mentioned, periodontal disease and diabetes both are painless. So patients don't come to you because they don't realize that it is important, and they come to you only when it is severe discomfort, and when they find that it is unbearable, then that's the time when they come to you. And by then, you know how it is. It's almost like tooth is moving and you have to remove it. Nothing else can be done. So that is the main problem with it. Like we say it's silent killer, like a hypertension. Diabetes is one of the silent killers. So what is important is the awareness, which I think the other panelists also mentioned earlier also. And especially in UAE, the lifestyle is a little different. People don't follow regular routine
Yes.
exercises and all, and plus the diet is very bad there. So that is one of the reasons why the rate of diabetes is quite high in the Middle East as compared to other countries. I'm sure in India also is quite bad, but there it is, I feel, much higher than what we have here. So that is one important factor or a point which has to be noted to control diabetes. Whatever said and done, as periodontists, we can only advise, we can only do a treatment which is within our control. But if the patient doesn't support us, we are helpless.
Yes.
So that is my opinion about diabetes, and it's been there for years. So we hope in future we'll come up with something which is much comfortable or easier for both the patient and the periodontist in general. So I'd like to thank Dr. Sheila. It's nice to listen to her for a long time. It's almost more than 25, 30 years almost. I'm not sure. I think 98, yeah, almost 30 years I have been with her. So I hope to meet her face to face in next seminar, not webinar, in post-COVID, so that we can have an one-to-one interactive sessions and can talk or a cup of tea. So thanks the organizers, Dr. Anita and the other members for taking up such an important and very crucial, a topic which is very relevant in this pandemic. Especially, we have seen that patients who are diabetes are comorbidities for the COVID. So thank you very much, and over to Dr. Sheila and the panelists, the organizers. I think we are going to play the video. And thank you to you, Doctor.
Thank you very much for your inputs. And I think Sumukh, you can play the video now.
Just before playing the video, I have one thing to say. Deepika madam.
Yes.
The thing is, yesterday one of the students, somebody had asked about glycated hemoglobin. Do we have a chest side?
Yes.
We do have. It is by the Bayer company, and it is similar to a glucometer. Only it is very sensitive to use. So you have to use it within 2 minutes. It's A1C now is the name of it. And I think Dr. Vandana madam might be knowing, because it was used in Davangere. They have written an article. I think Dr. Soumya, somebody has done that. And also somewhere in the north, in Maharashtra, somewhere also it has been used. So yes, so this webinar has also taught me to go about and search about things which I actually didn't know this was available. So this is to the person who asked that question.
Okay,
yeah, and carry on with the video.
Okay, thank you very much. Yeah, I think we'll get on with the video. Yeah.
This is not an exaggeration, but a reality which the people faces in this village. The gum disease. This village is all set to defeat gum diseases, and it's all because of this man. His name is Prakash. He is the electrician of the village, a very happy person to spread light into other people's life. But he was always worried about the fading smiles of his village. One day, he too lost his tooth. His wife told him,
"Please visit a dentist."
Desperately, Prakash made his first dental visit. He was so tensed. The dentist examined his mouth, filled with tartar and inflamed gums. Finally, he was diagnosed with severe gum disease called periodontitis. Prakash was shocked and he asked,
"How can this happen to me, doctor? I never had any pain."
The doctor convinced Prakash about the painless nature of the disease. He also showed how his bone levels have gone down and what treatments can be done for it. He was also told to come back for cleaning and gum surgery. He went back to his village. There, he found all the negative comments about dental treatments and surgeries. Prakash was so confused, but his wife told him,
"Please do what doctor says."
Prakash soon got his dental treatments done and started motivating the village people. see the changes that was happening. The lost mile started coming back. This man lit the life of his people. So today be the reason someone smiles tomorrow.
Thank you, ma'am. That was an excellent video. Thank you, Dr. Sheila, ma'am. Thank you, Dr. Deepika, ma'am. And thank you, Dr. Vijay Desai, sir. I request Dr. Sheila, ma'am, to accept the certificate as a token of appreciation. I also request Dr. Deepika, ma'am, and Dr. Vijay Desai, sir, to accept the certificate as a token of appreciation.
Thank you. Thank you very much. Thanks for inviting me and being part of your webinar. Thank you. All the best.
Thank you, sir. Learning is the only thing the mind never exhausts, never fears, and never regrets. We have so much to learn even now. With this, I conclude the end of the third day of our webinar, but the show is not over yet. We'll be back again tomorrow with interesting topics ahead.
Thank you, Maitri.
Thank you. Thank you,
all
Dr.
our
Sheila. Thank you.
panelists.
See you.
Okay, bye.
Take care.